Hi, happy International Women's Day. So these words should not be a mouthful, okay? After today, you're all going to get better at it. So today we're going to talk about stigma and women's health. So let me start by asking you this. When you think of the outside female genitals, what word comes to mind? I bet many of you said vagina, or maybe you called it the vajayjay, like Bailey on Grey's Anatomy. It's less likely that you use the word vulva, or maybe you have some other term you use. But often I find that people just say, I have a problem down there. And this is a problem because there's more than one important thing down there. So today we're going to talk about vulvas and vaginas and the importance of knowing the correct names and being comfortable using them. But first, an anatomy lesson of down there. You guys are laughing, but this is very important. So the vulva is what you see. If you took a mirror and you looked, it's the outside female genitalia. Whereas the vagina is actually the inside tube-like structure. It would be the vagina is the place you'd put a tampon. All right? Okay, so let's talk about stigma. Many women aren't comfortable properly naming their body parts. They don't talk about gynecologic body parts or problems with their family or their friends or their kids. And they often aren't comfortable seeking medical care if there's a problem. Why does this matter? It matters because I see things like vulvar cancer showing up at very advanced stages. So cancers are staged from 1 to 4, with 1 being the earliest cancers and 4 being the latest cancers. Most vulvar cancer in Canada, sadly, shows up at a stage 3. So vulvar cancers they're slow-growing cancers, and they have symptoms. So it's really upsetting that people show up when it's much harder to treat it, and sometimes it's become incurable at that point. And why does this happen? Stigma. People say, I can't talk about it. They say, maybe these symptoms will go away. I didn't know I could get cancer there. I didn't want to tell or show my doctor because he's a guy. I was embarrassed, etc. And it's so sad to see how stigma leads to more suffering and even death in women. So I'm a gynecologist at Women's College, and many patients I see have suffered for years. They're often embarrassed and they don't seek help. Stigma strikes again. Symptoms like vulvovaginal itch, bleeding, pain, dryness, discharge, pain with sex, peeing when you cough, sneeze, or laugh. These are all common issues, but it's not common that people are comfortable talking about them. Again, we have people suffering and being uncomfortable bringing these issues up with their doctor, and it doesn't seem to matter whether you're 20 or whether you're 80, there's still stigma. And men don't seem to have this issue. Word on the street is if they have a lump or bump on their penis or it starts bleeding, they're in the doctor's office pretty quick. So in order to get better care, we need to get over this embarrassment. Another problem is education. Education regarding genital anatomy, sex, understanding our bodies, what's normal and abnormal. That education's not great. There's an attempt to improve this in schools, but we have a long way to go. We need to start having everyone comfortable even saying words like vulva and vagina. Due to a lack of knowledge, often when vulvovaginal symptoms occur, women think, oh, it's just a yeast infection. It's not just a yeast infection most of the time. It could be normal aging, but they blame that, they Google, they self-treat, or they do nothing and they just hope it gets better. And we often see that there's a delay in seeking medical care, and many never seek medical care and just suffer in silence. So enter me. I'm a gynecologist using words like vulva, vagina, cervix all day. It's my job. I'm used to it. But I didn't grow up hearing these words. My mom didn't talk about it. She still doesn't. There was nothing at my school. And I think that likely this is how many of you also grew up. And when you never talk about it, then there's shame and embarrassment when problems come up. So again, the first thing we all need to do is get comfortable using the words vulva and vagina. They're not bad words, they're not dirty words, and you can normalize them into your day-to-day conversation. Do you worry about talking about your face or your arm or your foot? No, because they're just body parts. So I've always been a fan of using correct terms with my kids from day one, which has led to some interesting situations. So when my daughter was 4 and we were taking the TTC together, she asked me loudly if I was going to go look at vulvas today. And when the grade 2 gym teacher asked my son recently, what do your parents do? And he said, oh, they're doctors. I said, what kind? He said, my daddy's a lung doctor, my mommy's a vulva doctor. But you know what? It's okay to use these words. It's okay for your kids to use these words. They're just body parts, like all your other body parts. And on that note, how many of you know what your own vulva looks like? Could you recognize it if you put it up in a photo on the wall? Anybody? Yeah, that's what I thought. But again, I bet that most men could recognize their penis. So, something I try really hard, but this is hard. I've been trying to get my patients to actually look at their own vulvas. So check your vulva. It's such an important step in understanding your body. So as we all have different faces and hair colors, we all have different vulvas. And becoming familiar with what your vulva looks like means that it's easier for you to identify if there's something wrong. And if there's something wrong or you have a concern, then you can seek help early. If you check your breasts, you can check your vulva. The next thing we need to normalize is talking about women's health issues in general. Women should not have to suffer in silence. Did you know that 1 in 6 pregnancies end in a miscarriage? It's super common, but it's not common that we talk about it. And if you've never had a miscarriage, I'm sure that one of your family or friends has, and chances are you don't know about it. Another taboo topic is infertility. Even though these problems are quite common, women are now told from a young age that they can do anything in life. And while this empowerment is great, it leads to the misconception that you can get pregnant no problem whenever you want, and that just isn't true. Fertility decreases after the age of 30, and it dramatically decreases after the age of 35, and it's extremely hard to get pregnant after the age of 40. So many people are surprised to find this out when they're in their mid-30s and they run into trouble with pregnancy or recurrent miscarriages. And I find it's even worse when you're suffering with sexual concerns or menopause. These are not things you hear about in everyday conversation, but again, they're really common. Remember, not all women will have a baby or a pregnancy, but if you live long enough, you will experience menopause. Our population is aging, and we need to focus on aging well. Okay, so let's talk about estrogen. Estrogen is the circulating female hormone that we all have that plays a critical role in the development and maintenance of the female reproductive system. It's important to our overall health and well-being. So as young girls, estrogen is important for your breast development and regulating periods. It protects your bones from osteoporosis. And did you know that before menopause, women are at a decreased risk of heart attacks compared to men? But this advantage goes away after menopause. Estrogen is important for your cholesterol. It can affect mood and sexual function. So in the 4 to 6 years before menopause, estrogen fluctuates up and down. Then if the levels get really low, you go into menopause and your periods stop completely. And when you have all these shifts, you get hot flashes and night sweats and lack of libido, sleep disturbances, mood swings, headaches, joint pain, brain fog, and then there's the vagina again. So estrogen keeps the vagina stretchy and elastic and more lubricated. And the more years you go without estrogen, the drier and less elastic the vagina gets, which makes sex painful. Many women develop an increased need to pee and recurrent bladder infections. Doesn't that sound like fun? So 50% of women will have pain with sex when they go through menopause. And sadly, of those women, only 1 in 20 are treated. Again, back to stigma, most women just suffer in silence. On TV and in movies, women over 40 don't have sex lives. But we know this isn't true. Sex remains important for quality of life for women as they age. And it's a huge myth that older women don't have sex. I've seen women in their 60s to 80s who have a much more active sex life than some women in their 20s and 30s. And you just can't make assumptions based on sex and age. So back to that low estrogen, painful sex, dryness, and all those problems, the hot flashes, not sleeping, joints hurting, and people suffering in silence, but they don't have to, because almost every single one of those symptoms is treatable. The treatments depend on what symptoms you have, and sometimes we replace the estrogen. But as soon as we talk about in gynecology, as soon as we start recommending estrogen, people say, nope, not gonna do it, I don't wanna get breast cancer. So you need to know that when you use estrogen in the vagina, so locally, so to treat those things like painful sex and recurrent bladder infections and dryness, you are actually not increasing your breast cancer risk. Local estrogen has no breast cancer risk. This is different than when we use estrogen systemically. So if you take a pill or patch or a gel, which is used for things like hot flashes, then there's a risk. So in general, in the first 5 years after menopause, if you take systemic or combined hormone replacement therapy, you increase your breast cancer risk very minimally. For every 100 women who take it, you increase your breast cancer risk by 0.8, so less than 1 in 100. To contrast this, if you drink 1 alcoholic beverage a day, you increase your breast cancer risk by 7 to 10% compared to non-drinkers, but nobody seems to worry about that. The risks are higher if you stay on combined hormone therapy for more than 5 years or if you start later in life. But again, you have to individualize decisions to people. You have to talk to your doctor because those risks may be worth it to you for quality of life. Remember, if you start taking hormone replacement, it can take 2 to 3 months before you see any effects. People don't have to suffer when we have safe options for treatment. We should be doing everything we can so that women are not just living longer, but are also having a healthier, happier time doing it. The effects of stigma start small, and they're not always obvious. Remember at the beginning, I said that most vulvar cancers show up in Canada at very advanced stages, despite that they're symptomatic and slow growing. Many women don't realize vulvar cancer can even exist. They live with that sore area and they let it get worse and worse as the cancer grows and grows because they're embarrassed to talk about it or show it to a doctor. And then the treatments get much worse and the survival goes way down. It's very sad. And then I take care of all kinds of skin conditions that cause scarring and loss of anatomy. And people show up at very advanced disease because they don't look at their skin, they don't check their vulva, and they're embarrassed about the symptoms. When we normalize that to be a woman means to suffer, we are worsening the quality of life for all of us. When we look to the future, I want to see that we're all comfortable with our bodies, the right names, and that we can ask for help when things aren't right. So today, on International Women's Day, we're here together building a future where women don't have to suffer, where we can break down barriers to care so that there's better health for all of us. Thank you so much.